In this video, we are going to discuss regarding brain herniation. So I am going to start brain herniation. So think once, like our school is the box like, okay, sealed box, and there is some fixed content like brain tissue, then blood and CFS, cerebral spinal fluid, and these are in the fixed amount. If anyone is increased, then another should be decreased, or so making balance between this content in the skull. So this is the sealed box, and so if anyone is increasing and another was not decreasing and not making the balance, then leading to the increased pressure inside this box or in the skull, increased pressure in the skull, so lead to increased intracranial pressure, and anything lead to the intracranial pressure, so that lead to the brain herniation. So the what is what are the things or what are the causes of the increased intracranial pressure? Causes of intracranial pressure, causes of increase in the intracranial pressure. So like tumor, if there is tumor or there is bleeding like epidural bleeding or subdural bleeding, and that leads to the increased this pressure inside the skull. Also, if there is a swallowing like edema, and also some pus like abscess, also like there is, if there is a hydrocephalus like CSF build up. So these things lead to increased abnormal amount of pressure inside the skull, so it leads to the increased intracranial pressure, and when this increase, that lead to the there is no any around opening in the like there is no any outside inside, from inside to outside in the skull, so maintain the pressure, so that lead to the compression of brain and other parts of the body. So, and this movement, this pressure lead to the, and this pressure increase lead to the brain to the migrate or escape from this pressure, so there is no room, and it try to move through the opening, or the brain like to the move from opening or around that hard structures, like this is a skull, and inside the brain, if anything is in, like there is tumor or increase the pressure or anything, that lead to the press this portion of the brain, and this if there is any opening or anything, then the brain passes through that. So that leads to herniation. So there is the brain dividers, like we have already discussed, like there is the falx cerebri. It's divide, like this is cerebrum and this is falx cerebri, and it's divide two in hemisphere, cerebrum into two part, left and right, and left in two part. Also there is tentorium cerebelli, like when we look in this manner, cerebellum, pons, medulla and mediastinum. In the cerebrum and between the cerebellum there is a this is tentorium. So this is called tentorium, known as tentorium cerebelli, and it's divide, it's separate cerebrum and cerebellum, cerebrum and cerebellum. So another one is foramen of magnum. This from the school, base of the skull, and there is the foramen magnum, and from the foramen magnum a spinal cord passes. So this is some overview. So now we are going to there is some herniation, like the herniation are type of herniation. First one is subfalcine herniation, or also known as under the falx cerebri, this herniation. And another one is transtentorial herniation. After that there is tonsillar herniation. Also it's through the foramen of magnum, we discuss more in detail of these all. Like subfalcine herniation is in this is the falx cerebri, and it is separating the left and right hemisphere of the cerebrum. So if any muscle, anything is suppressing, then from this the brain are passing through the at the position of this cerebri is known as falx cerebri. This is known as subfalcine herniation. If there is this action is going on, so there is some defects, and there is like direction. When we look for the direction, and there is like cingulate gyrus, like top part of the brain. This is the top part of the brain, and that's are herniating. And top part of brain move under the falx cerebri. Again of this herniation that lead to the like anterior cerebral artery get squashed, and that lead to the decrease blood flow or the stop of the blood flow in the frontal lobe, decrease blood flow or stop the blood flow. So that lead to the in the clinical presentation in the patient the weakness of the leg, and like in the frontal lobe and also in the like in medial portion. So there is the weakness of leg. Like when we look in this image, here is like for the portion for the leg, there is the cortex region for the legs. So in the medial side there is a cortex region for the legs, so there is a weakness of the leg. Regarding tentorial herniation, in tentorial is it's in the through the tentorium. If any herniation through this tentorium, so there is any herniation like brain is passing through this, that leading to the suppression on the pons and medulla, and that lead to the more complicated or fatal condition. So this is known as transtentorial herniation. And the transtentorial herniation, there is mainly the portion from the temporal lobe and get down through the opening of the tentorium, and there is tentorial lobe is also on cause. So inner part of, like when we look the inner part of the temporal lobe passes through the opening between the tentorium. So moving on, there is some severe complication in this region. So what are the complications we can discuss? Like there is in the midbrain, there is the cranial nerve 3, oculomotor nerve is originated, and if there is the like compression of this nerve, that lead to the or any defect that lead to dilation of the pupil, dilated pupil. And there is also posterior cerebral artery. If it is suppressed or any defected, there is the vision loss or occipital lobe infarct. Due to the occipital lobe infarct, and there is the brainstem, like this portion is the brainstem, and if there is herniation leading to the suppression of the brainstem, cross cerebri brainstem, and that lead to the or also cross cerebri. So that lead to the hemiparesis means weakness of, can be same side or opposite side, of the body, same side or opposite side. Moving on, there is the brainstem blood vessels, like there is passing the basilar artery and some other blood vessels. So if there is the defect lead to the brainstem vessels, that is most fatal. So or lead to the durate hemorrhage, Durate hemorrhage. So this leads to the fatal bleeding in midbrain and pons. And there is also in this region there is a reticular formation. So in the reticular formation is defected, so that leads to the consciousness, loss of consciousness, or lead to the coma. So in the tentorial herniation that leads to the most fatal, so that if not treated in the timely. So regarding moving on the tonsillar herniation, tonsillar herniation from the foramen magnum, it's like this cerebellum portion. This is the foramen magnum. This portion is the foramen magnum. In the foramen magnum, if the cerebral content passing through this cerebellum is passing through this, that is known as the tonsillar herniation. In the tonsillar herniation, mainly medulla oblongata. In the reset the medulla oblongata, and it is the control center for the breathing. It is control center for breathing, respiratory center, and heart rate or cardiac. So this result, if there is the herniation and that leads to defect, that leads to the result of the respiratory arrest and cardiac arrest, also lead to cardiac arrest. It is most fatal, and there is the death mainly. So it is a most dangerous herniation. This is the most dangerous. It's a most dangerous herniation. Moving on this, so you can look in this image also, and this I also have covered herniation. So moving on some summary point of the view, simplest. So there is the herniation, like moving on the summary portion or in the short revision in the table, like easy to divide in 4 row, and there is a topic like herniation, then part of brain part move, part of brain parts moves, then there is a danger situations, dangers, and the sign, what the sign presented with the patient. So moving on the first one, there is soft halcyon herniation, and there is the part of the like cingulate gyrus under falx, and the dangerous condition is compression, anterior server compressed, and that leads to leg weakness. Again there is like tentorial, transtentorial. In the transtentorial, it's under the temporal lobe of the inner middle portion of the temporal lobe, like temporal lobe, and oncus through the tentorium, tentorium through tentorium. And here is the most affected portion is the cranial nerve 3, then posterior cerebral artery, and also brainstem. This is compressed in the soft hilation. There is a compression of anterior cerebral artery, but in the position of the transtentorial, there is the posterior cerebral artery and brainstem. So when we look the sign and symptom of the patient, there is a dilated pupil, vision loss, and also must be coma. Now at the end there is tonsillar herniation. There is the affected portion or the brain part is cerebellar tonsil through foramen magnum, and it compress the medulla oblongata, medulla compression, and that leads to the death due to the cardiac arrest or respiratory arrest. This is all about the herniation. So we have discussed basis of the this is some result. So